Hi, I recently went to a eClinicalWorks Day event, and this is an event that eClinicalWorks puts together, eClinicalWorks being the EHR vendor. They put it together for their clients, and it's a good event. I really commend them for putting this event together because it's an event where they can showcase their product, showcase their company, and show their clients and prospects what they're doing as a company and how they can benefit from using their systems. Now, I attended the event. It's mainly because I support practices that are using eClinicalWorks. So I thought it would be good for me to attend and get immersed in what that vendor is doing for their clients, and bring back some information for me to share with you and other people that are using eClinicalWorks. So the event happens every couple of months. They have it throughout the country. So if you're an eClinicalWorks user or client, check them out, check out their website, and find out when is the next date that they're putting this event together so you can attend. I highly recommend you go, or you send somebody from your staff to participate in that event and bring back to your office the information. Basically, that's what I'm doing. I went and I took my notes, and I learned a lot from the company and from the products and from their new updates. And so I have tons of information to share with you, and I'm going to go over right now a couple of points of what they highlight, what they went over. And if you're interested, we can have a conversation and discuss some of the items that we talked about in more detail. So basically, they went over, they introduced themselves, introduced the company, and introduced the new product, the new upgrade that they have. Now, something important that I think it's good to point out is that I know there's a lot of practices that have eClinicalWorks, and they set it up a few years ago, and they have a pretty plain vanilla installation. And what happened is that eClinicalWorks as a company does continuous updates and upgrades and enhancements and adds additional services to their offerings. And what I find is that these practices that don't do any updates or look at what eClinicalWorks has to offer, they're missing out on some important features and enhancements. I picked up a few of them when I went to the event, and I'm going to share with you a couple of them. So it's good to that you have it if you already have the EHR, but it's also good to stay up to date with what new features and enhancements they have, so you can use not only but you can have them installed, but so you can use them, and so your practice can benefit from them. So one of the topics they hit was population health, and they talked about macro. So they went into high level about macro, MIPS, APMS, and how what you need to do to comply. And also they explained a couple of features that eClinicalWorks has coming. Like, for example, they have a MIPS dashboard coming up soon, and that's very important if you're participating in MIPS and you need a way to track your progress. They're going to have a dashboard coming up very soon. So those are kind of some of the things that we talked about. They talked about. They also mentioned about interoperability. That's a big feature, a big important feature that you should be aware of. And that has to do with the capability of looking at patient records from the hospital and from the practice, and vice versa. Bidirectional connection, where if you're sitting in the office in your practice and you want to know if the patient visited the hospital or what records they have or what they did, there's an interface where you can view the records that the patient has from the hospital, and vice versa. If you're in the hospital, you can view records from your eClinicalWorks. That functionality is something that the industry has been working on since the beginning. I mean, that's kind of one of the benefits of EHR, and it has to do with the promise of being able to interchange data. And so eClinicalWorks is participating in that with two large vendors, and basically it's a feature that you should look into, and it's free. It doesn't cost you anything. And some practices, I know that you're using the hospital system where you're going to connect remotely in order to see the patient records, but this functionality allows you to see the patient records within eClinicalWorks. so you don't have to skip and jump around different applications. So again, I'm not getting into details, but we can discuss that more if you're interested. Then they talked about safety, patient safety, and they discussed typical high level, nothing exactly related with eClinicalWorks, but in general, how best practices for patient safety, doing risk assessments, and et cetera. I'm always been an advocate of doing your mandatory risk assessments, and that's something that we do on a regular basis if you're interested in doing risk assessments, a HIPAA risk assessment. So they discussed that. And then they talked about a couple of features and enhancements to the products that they have, and what value it provides to the providers and the practices. And there's a lot of features that some practices they participating, the ones that were at the event, that they didn't really know about this event, and I'm sure a lot of you may not know about it either. And again, we can get into that conversation, but there's a lot of cost savings, not just in features and enhancements, but things that can cut costs right away. For example, I learned that as of last year, eClinicalWorks did away with the requirement to have static IP address. If you know about the static IP address, that's an additional cost to your practice. So now that you're not required to have that, because they opened that up to dynamic IPs, you can use your executable from any location. Now that's a cost saving to you. So for example, that could cost you $20, at least $20 a month from your internet provider. So now you can get rid of that and save yourself $20 a month. So this and other features and enhancements and tidbits we learned at that event. And again, we can talk about that more. But it's very good very good news for a lot of practices when they heard about that. So other things, like I said, they're going to have a dashboard. Their new version, the version 10E, which they say it stands for everywhere, which is actually a web-based version, a browser-based version of eClinicalWorks. So it's not only is it cloud-based like you know about, but it's also web-based. So you can literally go to a web browser and log into eClinicalWorks and access your patient information, your practice information. It's not meant to replace the current version that you're using, but it's at least not yet. So it's a new version that's going to have a lot of features and improvements and because it's web-based, it's going to be easily upgradable because all the services are available right away when they have it on the web. So that's one of the features that were very interesting to hear about, and the screens and the interface, the more up-to-date interface that they have. They also talked about patient engagement. Patient engagement is very important for everybody to look into, and that has to do with the concept of you're not only in business to provide healthcare. That's your main goal, but as a business, you have to treat your patients as customers, because you are a business, and customers, people, have choices, what providers to choose, and they compare doctors and practices. So it's not just about the quality of health, it's also the quality of the practice in general as a whole. So you have to have a holistic view of your practice, and when you're dealing with patients, you have to engage them in more ways than one. Often I see that patients, when they go to practices, the practices only know about the patients like once a year or whenever somebody's sick. So there's no interaction, there's no ongoing relationship with the patients. That's what's called a patient engagement. And there's many opportunities there for you as a practice to engage patients more. And that in turn translates into better outcomes and also a better income, because there's opportunities for income when you have your patients more engaged and more up to date on what they need to do, what they need to stay on top of, etc. So again, it's more kind of like thinking as a business. It's nothing new, but it's in the healthcare industry, we're kind of lagging behind on that area. So eClinicalWorks has some services, some features and enhancements that you can use for patient engagement. Like for example, the messaging. They have a functionality where you can send messages, email reminders. Save yourself a lot of money in mailings if you do, for example, mailings. Save yourself the postage and do some electronic messages. Reminders, just typical reminders, birthday, holidays, appointment reminders, follow-up surveys. Those are the kind of things that keep people engaged, and so patients see you more often, not just necessarily when they're sick, but you can bring up something to their attention that might bring them into the office to follow up on. Okay, so that's an example of what has to do with patient engagement. They also talked about the patient portal, kiosk, and payments, how to increase payments with your copay, with paying electronically, and other areas of improvement. Then they talked about different partners that they have working with in terms of patient education, collections, voice recognition, medical search terminology. So these are all areas, like, with MIPS, you have a lot of points that you have to basically fulfill in order to get the credits or the incentives. So it's important for you to leverage the vendors to do these different things that you will need to do to improve the quality of care. So you don't need to do everything by yourself, but that's where you partner with different vendors and different services that are available to do that. So overall, it was a good event, and they handed out a lot of information. There's like a booklet. Here's like a booklet, eClinicalWorks Day, and it's a lot of information was given here. Very, very interesting. There's a Q&A, so like I said, if you're interested in more information on what was covered on that day, I'm happy to share my personal notes on what took place, and discuss your installation and what features that you can use to right away increase patient engagement, have some cost savings, immediate cost savings, and improve your practice overall. Because, like I said, it's not just about quality of care, patient care, health care, but you also have to think about a holistic view of your practice and how you can improve it. Something costs additional money. Yes, I heard that in the group when they were talking about different services. Yes, something costs more, an additional cost for this, an additional cost for that. However, you have to think about it like a business. Like I said, it's very important. If something costs an additional amount of money, don't just think about it as a cost. Think about it as an investment, and that you're going to have a return on that investment that's going to be higher than what you're paying for. So don't just close the door just because something costs money. And that doesn't have to do just with eClinicalWorks, with any vendor, even with your IT provider or anything. If you're looking for something to improve your practice and it costs some money, you have to see how is that going to translate into a return on investment. And it might not translate directly with a cost associated, but it can affect another area in the practice indirectly because of one thing that you're paying for. So you might not see a one-on-one relation, but overall, if it improves your practice, it increases patient satisfaction, quality of care, patient engagement, return visits, reviews, etc. All of that bundles together. So be open-minded when it comes to different services, and your practice will distinguish itself from other practices and be a better practice. So give me a call, reach out to me, and I'll be happy to continue this conversation. Thank you.